Rhode Island National Guard is once again being asked to step in to help staffing over at area hospitals. Governor Dan McKee making that announcement today. He's also looking to the federal government for more assistance. 12 News reporter Anita Buffoni was at today's briefing. She joins us now live in Providence with what the governor had to say. Anita?
Well, Mike, the staffing crisis at hospitals has been hitting the healthcare system hard, and it doesn't seem to be letting up. Now the governor is asking the National Guard to help once again to help with the staffing crisis.
Help from the Rhode Island National Guard is expanding. 30 additional members will be scattered throughout 10 hospitals.
The theory behind the smaller numbers at these 10 other hospitals is essentially to lay groundwork, to lay the liaison sort of relationships to get a feel for what the hospitals may or may not need.
This is on top of the 45 members mobilized to support Butler Hospital and relieve pressure on hospital emergency departments.
Duties include patient monitoring, screening, ER waiting room, attendant, some in-hospital patient transportation.
This assistance is in addition to help from the medical teams sent to the Ocean State by President Joe Biden. Now, Governor Dan McKee is requesting the federal government for a 30-day extension, flanked by the transition team in place to help search for a new health department director. The governor touting a recent visit to the DOH.
Transitions can, can be disruptive, or they can be very positive, and so we're making every move we can, and we're showing that today, that the transition is going very smoothly. And
despite multiple reports of tension between McKee and former health director Dr. Nicole Alexander Scott, McKee denied there was poor communication between his office and the DOH.
Now, Governor McKee says he supports a bill sponsored by Democratic leaders that would extend his emergency powers until April. But Republicans say Rhode Islanders have been under emergency authority for too long, and they want to see that authority revoked sooner. For now, live in Providence, I'm Anita Buffoni, 12 News.
Tonight, the Department of Health says another 13 Rhode Islanders with the virus have passed away, but all three of the weekly metrics the state has been tracking are down. Cases per 100,000 fell for the third week in a row, as did the weekly percent positive, though it remains above 10%. New hospital admissions decreased for the second week in a row, falling by more than 100.
And the number of people in the hospital is still high. Governor McKee has announced more help for the state's medical centers. 12 News reporter Anita Buffoni was at this afternoon's COVID briefing and joins us live from Providence. Anita?
Well, Shannon, the staffing shortage at hospitals has been a persistent problem recently. The governor now asking the National Guard to mobilize more of its members, this time to help at nearly all state hospitals.
Help from the National Guard started at Butler Hospital, with 45 Guard members deployed there that will in turn relieve pressure on other ER departments. Now 10 additional hospitals will receive a handful of National Guard men and women. Governor Dan McKee was asked at Tuesday's briefing why he didn't authorize the help sooner.
well, I think that it's, I really, other than the fact that we certainly was open to that weeks ago, and we're doing it now. And
in all, 75 members will be deployed to area hospitals. Their duties range from patient transportation to screening.
What we would call, in layman's terms, the wraparound services that allow for the higher end healthcare providers to do their work.
McKee will also request an extension for the medical teams sent by President Joe Biden to Rhode Island and Kent Hospital. Meanwhile, the governor's COVID emergency authority is the subject of hearings at the State House Tuesday night. Democratic leaders sponsored bills that would extend his emergency powers until April, something McKee supports. But Republicans say Rhode Islanders have been under emergency authority too long, and they want that authority to be revoked sooner.
And we're not abusing any rights. We're protecting the people in the state of Rhode Island.
Now, McKee touted a recent visit to the Department of Health where he described ways that his office will better work with the DOH, but he shot down the notion that there was poor communication between his office and the DOH when former Health Director Dr. Nicole Alexander Scott was at the helm. In Providence, I'm Anita Buffoni, 12 News.